there. My name is Dr. Cozy. I am the physician who will be leading your case. That being said, you will meet other doctors who will be working with me as well, because what we find, especially with infectious disease, is that when we all work together as a team and bring together our different experiences and skill sets, we tend to be able to come up with answers more quickly. Really quickly, can I just get you to verify for me your name and date of birth? Perfect. Do you know where you are? Yes, this is the Cozy Hospital. And do you know today's date? Month and year is fine if you don't know exactly. Perfect, okay. In just a moment, I'm going to be asking you a few different questions, but first I need to do a couple of tests just to make sure that there's nothing acute that we need to treat immediately, okay? So, put some gloves on here. And okay. So I have a Penlight here. If I can just have you direct your gaze right in between my eyebrows. Perfect. Okay. Good. Now try not to move your head at all. I'd just like you to follow my light, only tracking with your eyes. So, okay, good. Can I have you open your mouth for me, please? Thank you. Okay. All right. And I'm just going to be listening to your chest. Can I have you take a deep breath in for me? Good. And out. And again, deep breath in. And out. Again. And again. Great. Okay. So, can you tell me, when did your symptoms first start? And what was the first symptom that you noticed? You had a temperature, okay. Did you have chills, night sweats with that? Okay. And do you remember what your temperature started off at? Wow, okay. Has it stayed around that level? Has it increased or dipped at all? Pretty constant, okay. Any nausea or vomiting? How about any tremors, confusion, blurry vision? And I know you said that you had a headache, which is why we've got you lying down flat. On a scale of 1 to 10, 1 being very minor, like let's say like a paper cut, 10 being excruciating, like you're gonna pass out. Can you rate that pain level for me? Wow, okay. Any recent travel outside of the country in the last 6 months? How about in the country? Have you been around anyone who's been ill? It is hard to know these days, huh? How about, have you been around any farms and around any farm animals? Have you received MMR and varicella vaccination? How about COVID? It's hard to know. With new variants, we're discovering new things about it all the time. Okay. Is anyone else in your family or who lives with you showing any kind of symptoms? Do you own a pet cat? Have you been around a cat or a litter box? Okay. And I think that's all the questions I have for right now. So, since we did already have a nurse come in and collect some blood cultures from you, I'm not going to do that quite yet. We don't have a result for that yet. We did run its stats, so hopefully it should be very soon. I am going to collect some cultures from these lesions that we have here. Have you tried to pop any of these on your own? Good, okay, thank you. It's always best if we can avoid that. I'm going to take a few measurements just of the affected areas so that way we can keep track if in fact they start spreading or changing shape. So, maybe hold still for me just a moment. move your gown just a little here. Okay. We got everything there. All right. So now what I'd like to do is collect some specimens for culture, which will mean that I will need to lance some of these. They look almost like carbuncles, but some of these lesions, okay? I will be using a topical numbing agent, so that way this is as unpleasant, or this is not incredibly uncomfortable. There may still be some discomfort, okay? Okay. So, start. Going to be just giving a little spray, okay? So I'm going to shield your eyes. Okay. This is usually pretty fast acting, so can you feel that? In there? How about? Okay, good. Here. Alright, so you're going to feel a little bit of pressure, okay? Okay, try to stay very still. Okay. Pressure on this spot. Excuse me. We're gonna do one more area here. Let's see. Do right over here. This one will run for viral. I'm going to be right back. I'm going to go hand this off to one of my nurses to have it processed, okay? Okay. Hey, Chelsea. Hey, this is for a patient in room 304. Can I have you print out our requisition and fill it out for bacterial and gram stain? And then I marked which one I would like to have run for viral. And if we can order those stat, that would be great. Thank you. Okay. I'm going to apply just a little medication to keep those clean. And don't worry, this is not going to go on the skin. It's just going to be kind of soothing. Use an applicator to kind of gently rub it in. So I'm going to cut this down into strips. Went too fast. All right. going to very lightly bandage this, so only one piece of tape per each gauze, because I'm going to need to continue to reassess. Alright, so now I'm going to very gently kind of palpate the skin along your neck, under your jaw, across your shoulders, under your arms, okay? Yeah, we have quite a few lymph nodes here. Are these tender? Okay. Sorry, I know it's a little ticklish for people right there. I'm also going to feel along your arms. Take a look at your ears now, okay? Check the other side. Just gonna take a look at the external ears here. listened to your chest before, but now I'm going to take a listen to your tummy, okay? I'm going to press, okay? I want you to tell me if anywhere is tender, painful. Is that okay? There? I'm going to feel around your kidneys. Any discomfort there? A little? Okay. Equally on both sides, or is one worse than the other? Okay. Have you been urinating regularly? Okay. And color? Has it been normal or dark? Okay. Alright. Okay. So now I'm going to do some sensation testing with you, okay? And it's going to be using this kind of prickly wheel. As you can see, I'm rolling it on my hand, and while it's not the best feeling, it's not painful, and it's not puncturing my glove nor the skin, okay? So because the pain you're experiencing is radiating down the neck and into your upper back, it's important that we do some testing just to make sure that you're not experiencing any kind of numbness, okay? So you're going to feel this rolling up and down your arms, your legs, and then your feet. So I'm going to start. Keep hitting the exam table paper. Okay. Check your legs. Now your feet. Ticklish, I know. That's good though. Okay. Good. Now I'm going to be tapping on you to test your reflexes. All right, reflexes are intact. So now that we have completed an initial exam, I'm going to do something to help and see if we can't get your temperature to lower just a little bit, just to help make you a bit more comfortable. The antipyretics that we are giving you should also be assisting with that, but looking at the monitor, I can see it's quite a bit high still. So I'm going to provide you with some ice packs, okay? Okay. Start just by placing this drape over you so it's not directly on your skin. And put a paper drape on top of that. Okay. Put this one right there. Go right here. Okay. Is that okay? Would you like me to grab one more? It's okay to start. Okay. If you start getting too cold, let me know, alright? And we can add either another blanket or another drape to help and create more of a barrier. You're okay? Okay. Good. allergies that you left that blank. Is that because you don't have any known food or medication allergies? Okay. Have you ever had a CT before with contrast? Okay. Did you have any kind of reaction? Okay, good. So, I'm going to be ordering some different scans, CT scans, that I'd like to have done of your head and your neck, along with an abdominal CT with a focus on your kidneys. I will also be having a nurse come in here to place a catheter. And don't worry, they're very good at making sure that that process is very comfortable for you, just so that way we can, make sure that you're able to take care of your needs, and also so that we can obtain a very clean specimen, okay? All of these things will be run stat, so in just a moment I'm going to go and pass these orders along. Someone should get you pretty soon to bring you down to radiology, but that always depends on how backed up they are. If it is going to be a while, then you may see one of my colleagues coming in here to do their own exam, or we'll also have nurses coming in and out of here as well. In the meantime, built into the side panel here, that handlebar on your bed, you'll see there's a bunch of buttons. Some of them change the channels or the volume on the TV, but if you'll see, there's one button that's shaped like a little person. That one is the call button that will ring the nurse's station. If you need anything, please push that button. Don't hesitate. Someone will be right in to help you, okay? Okay. In the meantime, do you have any questions? Okay. Will you sit tight? Rest up. If you want to take a nap, that's totally fine. And someone from Transpo will come in to take you to radiology, or one of my colleagues will come in and do a consult, okay? Okay. I will come back in here and check on you again after I have some results.